All right, I think it's safe to go ahead and get started with our presentation today. I want to welcome to everybody on hopefully a informative webinar on consumer-driven health plans. My name is David Lindgren. I am the Compliance Officer here at Flexible Benefit Service Corporation and will be hosting the presentation today. Just want to go over a couple logistical items before we get started. Today's webinar is pre-certified for one general HRCI recertification credit. In order to qualify for the credit, we need you to remain on the webinar for the duration. If you do qualify to receive the credit, we will send the certificate of completion to you by email within 2 to 3 business days. So you should have that, I would presume, by Monday of next week. In addition, in order to eliminate any background noise, we put all phone lines on mute, and we will not be opening up those lines at all today during the webinar just to eliminate that background noise. If you do have questions during the presentation, please type them into the chat function. You should see that on the bottom right-hand side of your screen. I will address as many as I can, time permitted. We'll do our best to keep us on pace to get us out of here at 12 noon Central Time. Before we get into the presentation, I want to give everybody a quick background about our organization. We are Flexible Benefit Service Corporation. We go by FLEX for short. We are located in Rosemont, Illinois, which is just outside of Chicago, right next to O'Hare Airport. We have approximately 100 employees. Last year marked our 25th anniversary of being in business. We were founded back in 1988. We do operate with 3 primary business divisions within our organization. We are what's called a general agency, a benefits administrator, and we also offer our own private insurance exchange. Just to give you some details about each of those business divisions, as a general agency, some people also refer to us as a wholesale insurance distributor. We contract with thousands of insurance brokers, insurance producers, and other financial professionals throughout the country and provide access to different insurance company products that they can deliver and help employers, employees, individuals, retirees find appropriate coverage. This is just a snapshot of some of the different organizations that we work with from an insurance perspective. Aetna, Blue Cross, United Healthcare, Delta Dental, along with some others. Also, we are a benefits administrator, as I mentioned. Some people will refer to us as a third-party benefits administrator. We provide services directly to employers to help them properly administer and be compliant with cafeteria plans, health reimbursement arrangements, flexible spending accounts, including dependent care flexible spending accounts. We have our own proprietary health savings account. We administer COBRA as well as provide some other services. Within this particular benefits administration division, we are actually, according to Business Insurance Magazine, ranked the 9th largest benefits administrator in the country. While we'd love to be a little further up on that list, we're quite happy being in the top 10 list, seeing how every other organization that is within the top 10 ranking is generally a Fortune 1000 company. From a private insurance exchange perspective, our private insurance exchange is called InsureX Solutions. We help employers get a simplified employee benefit platform, generally using a defined contribution approach where employers can cap or fix their contributions towards premiums for the year. The online tools really streamline the benefits buying process and help alleviate some of that benefits administration tasks. Employees get access to online individual insurance coverage from multiple insurance companies, have a number of different tools to help them narrow down their selections, and we support all employee questions as it relates to product, service, claims, and so forth. Now, with that being said, that gives you a fairly good overview about who we are and what some of the services we offer are. And consumer-driven health plans are an area that we've been focusing on really all the way going back, I would say, to about 1997 when the initial consumer-driven health plans and the concept of consumer-driven health plans really came to the marketplace. And I want to start off by giving you a quick analogy here before we get into the details of the consumer-driven plans. Let's just say you have what I'll call a grocery store plan. and you have a $20 copay that when you go to the grocery store, all you have to pay is $20, and that $20 will get you anything that you can put in your cart. So with that being said, what would you do? What would you buy at the store if you could fill your cart up as high as you possibly could? Would you fill the cart up, or would you just buy the products that you actually needed? Would you buy brand name products, or would you buy generic products? And I think most people would probably buy more than they needed, and they would probably buy the products that are more higher cost or the brand name products if this so-called grocery store plan actually existed. So definitely there would be some unnecessary spending, probably some wasted products that expire, and probably some higher cost products purchased that could otherwise be obtained for a lower price through a generic offering. And that's kind of what I want you to keep in the back of your mind as you are going through the rest of the presentation here today. When we talk about what I'll refer to as traditional health insurance plans, these are really health insurance plans that use what I'll call a plan design that encourages unnecessary utilization. So, oftentimes having low deductibles and copays for several of the services. And generally, they all use what's known as a third-party payer. And that third-party payer creates a lack in price transparency. And what I mean by that is when there are low deductibles and there are low copays on a plan, and you have an insurance company that's administering the claims payment, oftentimes that individual isn't actually exposed to the true cost of the medical care. They're only exposed to what their actual cost is. And this third-party payer concept leads to that lack in price transparency. And as a result, there's a lead to higher costs because of the plan design and some of these features. Now, I just want to go over a couple stats with you before we dive any further. I came across a survey of employer-sponsored health benefits that was done by Kaiser, a West Coast-based firm. From 2003 to 2013, they were surveying employers on what the average cost of health insurance was. And I don't think it's any surprise to any of you on this call that the average premium costs have gone up rather dramatically over the last 10 years and seem to continue to be going up as we move into the future. But this chart really breaks down what the total cost of coverage was back in 2003 versus today. And this takes a look at it from a family contribution perspective. Back in 2003, it was already about $9,000 a year to cover the average family. And about one-third of that cost was paid for by the employee, with the balance being paid by the employer. And if you can see, those amounts have gone up dramatically over time. We're now looking at, just as of last year, the average family plan is costing over $16,000, again, with probably about a third of that cost being absorbed by the employee and the balance being absorbed by the employer. So some rather dramatic increases, an 80% increase in the total premium, and from an employee perspective, almost a 90% increase in what their contributions have been. And really just to kind of break down the numbers a little bit further here by plan type, I've got listed on here HMOs, PPOs, and high deductible health plans or HDHPs, and show what the premium costs are for these different plan types for single-only employee coverage and family coverage. And you can see, the numbers are fairly similar across plan types. But they've just gone up quite dramatically over the last 10-year time period. So when we talk about consumer-driven health plans are they're more or less, I'll call it a concept, but there are some key features and plan components to the concept that really are ultimately trying to lead to a more affordable way of providing health insurance benefits to employees, and still providing great protection for them in the event of a emergency, life-threatening, or catastrophic situation. So with a consumer-driven health plan, also referred to as a CDHP, these are going to use health insurance plan designs that are going to discourage unnecessary utilization and really encourage preventive treatment, as well as obtaining necessary treatment when that's applicable. These types of plans do a good job at engaging employees more so in the payment process, making them aware of what the true cost of coverage actually is and the true cost of receiving medical services. And because of that, there's an increased price awareness that leads to some changes in the way that they consume medical care. And the end result with the consumer-driven health plans, if structured correctly, if employees are educated and communications are sent to them about how these plans work and how they can effectively take advantage of some of the features, it does a good job at reducing employer as well as employee cost. And the exact cost savings will vary by employer based on what your current structure is versus the specific type of platform you end up transitioning to. So just to give you an idea of the features of a consumer-driven health plan, there's really what we identify as 5 primary components that make up a consumer-driven health plan. One of the first main components is that there's first dollar coverage for preventive care. And now with the Affordable Care Act, that's a requirement of most health insurance plans that exist. But these are really going to encourage employees, either for no cost or a very nominal copay, to go out and get that annual checkup. Make sure they get their blood work done. Make sure they're being screened for more serious conditions, and making sure they're trying to catch more serious illnesses at the earlier stages, so that they can be controlled, that employee can live a more well-balanced life, and ultimately it keeps obviously claims utilization down, which results in lower cost to both the employee and the employer. Now, the structure of the consumer-driven health plans on the health insurance component also will include a high deductible. And what is a high deductible? That's subjective. Usually you're going to see those deductibles in excess of $1,000 for single-only coverage, and twice that for plans that cover 2 or more individuals. But it really is subjective. How high is too high? That's debatable. But generally you're looking, I would say the more common consumer-driven health plans probably have somewhere about a $2,500 deductible for single coverage and twice that for family coverage. Of course, again, the deductibles are flexible in design based on what type of coverage you offer to your employer, but those averages about $2,500 is what we're seeing. Now, they're also the consumer-driven health plan is also going to have a similar out-of-pocket maximum to a more traditional health plan, and I have a screen coming up shortly that'll show you that. But really, these are designed, for worst-case scenario situations. In the event there's a major accident or a major illness, you're not, that employee's not going to be on the hook for a amount of out-of-pocket that would be any greater than that of a more traditional health plan. The plan design will also eliminate most copays other than a potential copay for preventive care, but really stripping the health insurance plan of copays for office visits, copays for specialist visits, copays for prescription drugs, and copays for other services. Those copays really are one of the main drivers in creating a lack of price transparency, and I'll dwell on that a little further as we get through this presentation. And the plan design of the health insurance coverage will also generally have a PPO network. So there is some flexibility and there is some choice in which providers those employees can see. Obviously, there's some cost advantages to seeing in-network physicians and in-network providers, but it does, the concept of consumer-driven health plans really is around providing choice to employees and putting them in charge with making some of their decisions as it relates to consuming the medical care that they need. So this illustrates really, this is just a hypothetical example of what a traditional style health plan PPO would look like versus a consumer-driven health plan PPO. So a traditional style plan, you'll probably see something with around $1,000 deductible. After that $1,000 deductible has been met, the plan's going to pay out a co-insurance percentage. So the insurance coverage in this example would cover 80% of benefits after the deductible has been met, with the employee's obligation being 20%. There is a stop loss on that, so that stop loss would expose the employee to a maximum out-of-pocket of $3,000. Preventive care would be covered generally at 100%. The traditional style plan is going to oftentimes have copays. So in this example, $20 office visit copay, $40 specialist visit copay, and then a pretty nice prescription drug card included, $10 for generics, $25 for preferred brand drugs, and $50 for non-preferred brand drugs. So that would be an example of a traditional style PPO plan. If we took a look at a consumer-driven style PPO health plan, that's going to have a higher deductible than your traditional plan. So you see this deductible is 3 times higher. So we're looking at a $3,000 individual deductible on here, or employee deductible. But after they've met that deductible, the plan pays out at 100%. And as a result, that plan is structured to have the same exact out-of-pocket maximum as your traditional style PPO plan. And really all services, presuming they are in-network services, are covered at 100% once that deductible has been met. The preventive care benefit will be 100% without having to satisfy the deductible. But things like office visits, specialists, prescription drugs, hospitalizations, therapeutical treatments, those will all be 100% coverage after the deductible has been met. So again, this is just to give you an idea of what the difference is between a traditional style and a consumer-driven style health plan. So, some other features that, the consumer-driven health plan really is comprised of a health insurance plan along with some other component benefits. So when we take a look at this style plan, you really have a higher deductible plan, right? So absent any other change, if you go from a $1,000 deductible to a $3,000 deductible, you're going to see some cost savings right there from a value of coverage perspective, a premium perspective. A $3,000 deductible is going to be less expensive than a $1,000 deductible. It should be common sense for most people to put that together. So right off the bat, by going to a higher deductible, you're going to have lower employer costs. And if you operate a self-insured plan, that higher deductible is going to lead not only to a lower overall applicable premium, but lower claims utilization, because there's a higher deductible that has to be satisfied before the plan starts paying out any benefits. You're going to generally see some lower employee cost as well, and that's primarily going to be related to lower premiums from their standpoint. And absent any other changes, these higher deductible plans, lead to these cost savings because the plan really isn't as rich in benefits, again, unless we add some other component benefits. So if I go back and look at this particular plan comparison, the traditional PPO plan would be perceived by most people to be a richer benefit plan than the consumer-driven health plan. So most people, absent cost or any other variables, would want a traditional PPO plan over a consumer-driven health plan. But I'm gonna talk about some other features here that may make the consumer-driven health plan look a lot more attractive than that traditional style PPO plan. So those higher deductibles leading to lower cost, is one of the reasons that these plans are becoming more popular. But the consumer-driven health plans are almost always going to include at least one additional item, and that's going to be an account-based health plan. And the type of account-based plans or the number of account-based plans will vary by plan design and will vary by setup and structure at each employer. But generally speaking, one of these three account-based health plans are going to be included. So you're usually going to see a healthcare flexible spending account included, a health reimbursement arrangement, or a health savings account. And those are commonly referred to as FSAs, HRAs, and HSAs. So I want to kind of elaborate a little bit more on the account-based health plans. Really, one of the primary reasons that we have account-based health plans is to get that employee engaged in the payment process. This is going to be money that is available to them to spend at their discretion for medical services, or in a lot of circumstances, save that money for a future potential catastrophic medical event. All of these plan features provide tax savings to both the employer and the employee. So employer contributions are going to be a tax-deductible expense, exempt from payroll taxes as well. And employee contributions, likewise, are similar, are going to be tax-deductible to them. Depending on the type of account, may earn interest on a tax-deferred basis. And if funds are used for medical expenses, can be accessed tax-free. So all of this, because we're now putting money in the employee's hands to use or potentially save, it really does help in creating and increasing price awareness. Now, really, there's several goals of consumer-driven health plans. But really, when we combine a high deductible health plan with an account-based plan like an FSA, HRA, or HSA, that's really what's going to create the consumer-driven health plan, putting those two together. And by putting those two together, the goal is to change employee spending behavior. And when I mean change employee spending behavior, I'll elaborate on this momentarily, but engage that employee in the payment process a little more and create incentive for them to consume lower medical care expenses. And by doing that, the end result is a reduction in cost to all parties involved, all stakeholders, employers as well as employees. So the spending behavior, this is an interesting concept, and I think a lot of people that are out there really don't really understand that at the core of a consumer-driven health plan, this is an additional way as to how costs are saved by both the employer and the employee. So when we take a look at the plan design itself, when you have a high deductible plan with no copays, it causes a greater exposure to the actual cost of medical service. If you have a plan that has a $20 copay for office visits, generally speaking, as a individual that's covered by that plan or an employee that's covered by that plan, the only cost that you see is the $20 payment that you make at the office visit. Well, in reality, the cost of that visit is much more than $20. You know, a general office visit is probably around $150, depending on the types of services. Could be more or less than that. Employees don't see that extra, $130, $150 or so that's picked up by the insurance plan. Similarly with prescription drugs, if you have a fixed copay for that, you generally only see that cost. There's a new hepatitis C drug that is available, and for a 12-week supply, it cost $86,000 in retail cost to obtain that. Well, just think, if you had a $50 copay, you might only see that $50 expense and not be aware that the drug that you are taking is $86,000 for a 12-week supply. So those copays really create a lack of knowing what the actual cost of medical care are. And if you make those benefits subject to the deductible, then you really start to see, what the actual cost of an office visit is, or what the actual cost of a prescription drug is. Now, there's, a lot of times when you transition from a traditional plan to a consumer-driven plan, and you take away those copays, it can be a difficult transition for some, and that's where the account-based plans really come into play, because it empowers the employees with money. It could be through employer and or employee contributions on a tax-favorable basis. It empowers them to use that money at their discretion for the medical expenses that they choose to use it for. So this provides them with incentive not to spend the money and save it for potential future medical expenses. And just to give you some spending, some actual spending behavior examples, if you structure the high deductible health plan to have that preventive care benefit covered first dollar, you may even want to add a wellness incentive. You see many employers giving some sort of reward to employees for getting an annual physical each year. Could be maybe a small gift card. It could be maybe a $50 bonus in their paycheck. But getting that physical exam done, that is going to help catch illnesses at an earlier stage. If an employee has high blood pressure or high cholesterol or a combination of both, it's going to be much better from a cost perspective to go in and see that physician periodically to check the blood work, to check the cholesterol, to check the blood pressure, and to take some maintenance medication to reduce the blood pressure and reduce the cholesterol. It's going to be much less expensive to do that than to have a situation where an employee might have, might develop a serious heart condition like a heart attack. The expenses for the average heart attack these days exceed $100,000 for care, and then if there is a heart attack, that ongoing medication thereafter can get rather expensive. So, one spending behavior change is to get them, try to encourage them to get their foot in the door of the doctor's office and get that annual checkup. Because the plan has a higher deductible and no copays for prescription drugs, this is going to encourage the employee to, and maybe ask their physician about using generic drugs as opposed to, a more expensive brand name drug. It's going to encourage employees to maybe take a look at getting a medical service done at an outpatient facility versus an inpatient facility. We have some access to some cost comparison tools here at our office, and if we just use an MRI as an example, the average cost of having an MRI completed at a hospital or in an otherwise inpatient facility runs right around $2,500. But if you get that MRI done at an outpatient facility, you're looking closer to somewhere about $1,100, $1,200. So, this is going to be one of the ways of getting employees, because the cost is exposed, and it's going to be money that's going to be their own money really that they're using, or their own money that they're trying to save for future medical expenses. It's really going to encourage them to start looking maybe more so at an outpatient clinic instead. Plans that have low copays for office visits tend to encourage or create unnecessary office visits for things that might be able to be otherwise treated by over-the-counter drugs. So, somebody might have a cold or just might be feeling a little bit under the weather. If they have a low copay, that just might incentivize them to go right to the office visit and try to get maybe some penicillin or some other prescription drug that the condition being minor might be able to otherwise be treated by Tylenol or some other over-the-counter medication. And one of the best things that you can incorporate with a consumer-driven health plan is some form of a web-based tool, or it could be a call center that employees can reach out to, where they can actually research the actual medical costs. Obviously, a lot of when you go into a doctor's office or you go into a hospital, there's generally not a board hanging up that says the exact cost of a particular service. a lot of times employees don't find out what the actual cost is until after the fact, after the services have been provided. So if you can incorporate some web-based tools or other services that would help them research the medical costs, that's going to make them a more educated consumer of medical care. Now, I want to talk a little bit about the account-based plans and really what some of the benefits and drawbacks are to each account. But again, really, the high deductible health plan with one of these account-based plans is going to ultimately create the consumer-driven plan and the consumer-driven experience. So we'll start with the flexible spending account because it's the most widely used account-based plan within our country. It's estimated that somewhere around 40 million people in our country are covered by a flexible spending account in some way, shape, or form. And really what a flexible spending account does is it gives employees the ability to make salary reductions on a pre-tax basis to pay for out-of-pocket medical expenses. And employer contributions are permitted to this account. I'll talk about that here shortly, but the way they're most widely used is with employee-only contributions. And so again, the employee is going to reduce their salary by a certain amount and have access to those funds as soon as they've made that salary reduction. From an employee's perspective, on those contributions, they're going to avoid federal income tax as well as state income tax. And from both the employee and the employer perspective, there's an avoidance of FICA taxes on those contributions. So there's no Medicare, there's no Social Security taxes on those contributions, and that's a 7.65% tax savings. Now, some details about the FSA itself. So there is a $2,500 salary reduction limit as mandated by the healthcare reform law, the Affordable Care Act. These limits used to be set by employers, but the healthcare reform law does require a $2,500 limit now. Now that limit is scaled for inflation and may adjust by slight amounts each year, but for this year and last year it is $2,500. There is a new $500 rollover provision that is up to the employer to allow. I would strongly encourage you to allow the FSA rollover because it's going to encourage participation into this whole consumer-driven plan and this account-based concept. In the past, there was no rollover provision allowed. So there was we refer to it as the use it or lose it rule as it relates to flexible spending accounts. And any unused funds at the end of the plan year were forfeited by the employee. And that made it very difficult for employees to make elections at the beginning of the year to determine how much they put in the account, or if they did put money in the account, they might have been much more conservative. But now that there is the option to include a rollover, it makes it a lot easier for employees to make elections into these accounts. And through the flexible spending account, funds can be used to reimburse any medical expense that's defined under Section 213D of the IRS Code, excluding insurance premiums. So they can use this money to pay their deductibles. They can use this money to pay any co-insurance. They can use the medical expenses. They can use the FSA funds to cover medical expenses that may not even be covered by the health insurance plan, such as maybe some dental or vision expenses, or maybe some chiropractic expenses that are treating a medical condition. Now, as it relates to employer contributions to the flexible spending account, there's just a couple things you need to be aware of. They are permitted. But really, there's two things you should take into consideration. If you are making contributions into the account, those should not exceed $500, or they should not exceed a dollar-for-dollar match to the employee's salary reduction. So if the employee put $1,000 into their FSA, as an employer, you should put no more than $1,000 into it as well. And reason being is there's if this is not done, it eliminates what is referred to as accepted benefit status, meaning the healthcare FSA becomes subject to a lot of additional rules and requirements under the Affordable Care Act, potential fees and other regulatory items that you would probably want to otherwise avoid if you could. And I will tell you that probably the best way to operate a flexible spending account, if you are able and it financially makes sense, is to do some form of a match. If an employee puts in money, you're going to match it. It might not be a dollar for dollar match. It could be 50 cents on the dollar. But that really gets the employees. They have a little more skin in the game, as I'll call it, and really creates incentive to participate in the flexible spending account. Now, as it relates to a health care or a health reimbursement arrangement, also known as an HRA, this is funded solely by the employer. I apologize, I think I have a typo there on the screen, but funded solely by the employer. No employee contributions into this type of account. And with an HRA, the funds can be used to reimburse any medical expense defined under 213D, but that is subject to employer restrictions. So you as an employer don't have to reimburse every 213D expense. You can structure the HRA as an example so it only allows for reimbursement of some deductible expenses, or it only allows for reimbursement of health plan expenses. So you don't have to reimburse any and all 213D expense. It can be a smaller subset of that. And then you as an employer can decide if there is a rollover feature and what that rollover feature is. So there's a great deal of flexibility with health reimbursement arrangements. You can have no rollover if you choose. You can have unlimited rollover, so any unused funds carry over to the next year. You can have rollover up to certain limits, or only a certain percentage of the funds roll over to the next. It really is up to you to create that rollover structure. Just need to make sure it's not non-discriminatory based on the employee classes that you offer. Now, a couple other things that you should know, and this is also something that has changed more recently from healthcare reform law, is in order to offer an HRA to your employee participants, the HRA generally must meet the definition of being integrated, and really what that generally means. There's a few other specs to meet the term integrated, or the definition of integrated, but really what that means is that employee participation is going to be limited to only those people that are also covered by an employer-sponsored plan. So it doesn't have to be your employer-sponsored plan. It could be their spouse's employer-sponsored plan, but you need to meet that definition. Otherwise, that HRA gets opened up to several different healthcare reform requirements that really would make it not very attractive as an employer to offer. So just keep in mind, participants should generally be on your health plan, and if you so choose, you can have participants of spouses' employer plans on there as well, but need to meet that definition of integrated. You can also have HRAs that are limited scope in nature. This really is just a technicality. Limited scope HRAs generally don't much have impact to the consumer-driven health plans, but a limited scope plan would reimburse accepted benefits only, so it would be something that might only reimburse dental or vision. All right, retiree HRA is becoming very popular as well, especially with larger employers, and this really is, a retiree HRA is really consumer-driven healthcare, at its finest. I think many of us in the industry would agree on. The definition of integration is not applicable, so retiree participants do not have to be covered by an employer-sponsored group health plan. that retiree HRA may reimburse any medical expense that's defined under IRS Code Section 213D. And that would include insurance premiums. So what we've seen, because of average utilization of retirees tends to be higher for medical care than that of the average active employee, that several employers are looking to maybe replace or transition their traditional retiree coverage with an IRA with an HRA that reimburses medical premiums. So let's say you might give those retirees $5,000 a year, and they can use that $5,000 for any medical expense or any insurance premium. So if you have a pre-65 retiree, they can use that to buy an individual major medical plan. If you have a 65 or older retiree, they can use that to pay their Medicare premiums, Medicare supplements, Part Ds, and so forth. If they have any balance left over, they can reimburse out-of-pocket costs. Really gives those employees or retirees a great deal of choice with how they want to use that money. And again, it's up to you to decide if there's any rollover feature there. So this is really a great option if you do offer retiree coverage today, and it's becoming quite a substantial expense. Now, from a health savings account or HSA perspective, this is probably one of the purest consumer-driven health plans that exist, because unlike a flexible spending account and unlike a health reimbursement account, health savings accounts require employees to enroll in a qualified high-deductible health plan. You can have an HRA that's integrated with any type of group health plan, or you can have an FSA that's offered with any type of group health plan. But an HSA requires somebody to re-enroll in a qualified high-deductible health plan. And there are some specs as it relates to what is a qualified plan. These adjust for inflation as well. These specs are set by the IRS. But employees would have to be enrolled in a plan that has a deductible that was a minimum of $1,250 for single coverage and $2,500 for family coverage. And there is an out-of-pocket max. The out-of-pocket max, of course, can be lower than these thresholds, but the plan can have no more out-of-pocket exposure than $6,350 for single coverage, $12,700 for family coverage, and that out-of-pocket max applies to in-network only. So you've got this higher deductible plan and maybe higher out-of-pocket plan, and by plan design, a qualified high deductible health plan cannot have any first dollar coverage for any benefit other than preventive care. So you're not having any copays on this plan potentially for anything other than preventive care in order to satisfy the qualified plan design requirements. There are some other eligibility requirements. For example, employees that are covered by two health insurance plans, maybe their own and their spouses. Both plans have to meet the qualified high deductible health plan requirements. So those are some things that you have to take into consideration as well. And employee and employer contributions are permitted. There are maximum contributions that you can make to the account. Those maximum contributions are listed here. There is a maximum contribution for this year of $3,300 for single coverage, $6,550 for family coverage, and there is a $1,000 catch-up contribution that's available for anybody aged 55 and up. And those contributions that you see are combined employer and employee contributions. So that $3,300 as an example, if an employer was putting $2,000 into the HRA or the HSA, that employee could only put $1,300 into it. So the nice thing about the HSA, it is an individually owned account, and it allows that employee to reimburse any medical expense defined under 213D. So really anything that is treating, preventing, or curing a medical condition is an allowable expense. The nice thing about the HSA is there is unlimited rollover accumulation. So once those funds hit the account, it's theirs. and it's theirs to keep. So as an employer, once you put that money in their account, it's theirs. You can't take it back. So those employees are incentivized to try and roll over funds and save for future medical expenses. We have a group of employers, sort of the precursor to health savings accounts were something referred to as medical savings accounts. Those were available from 1997 through 2004. Then the health savings account became available. But we have some employers that have employees that have been funding these accounts since going back to 1997. So about 17 years they've been funding these accounts. And some of these employees have balances in their account that now exceed $100,000. And you know, they truly do have an account. These employees, based on the structure of their consumer-driven health plan, have really, you know, changed their spending behaviors, are really smart consumers of health care. And the bottom line is they want to save that money, you know, for a potential, you know, catastrophic event or for retirement. You know, once they hit age 65, they can access those HSA funds for non-medical expenses. It will be subject to federal and state income taxes, but there will be no penalty at age 65 for accessing those funds for non-medical expenses. Whereas if you access those funds for non-medical expenses prior to age 65, you're paying taxes plus a 20% penalty. So, you know, this HSA account really does become a very, very valuable consumer-driven tool, but it does require a specific health plan to be enrolled in. Now, just some final comments, and if you do have questions, please go ahead and start to type those in, and I'll do my best to address as many as we can. You know, as it relates to the account-based health plans, employer matching really does increase that participation and acceptance of high-deductible health plans that are coupled with flexible spending accounts and or health reimbursement arrangements. Rollover will really increase participation and acceptance of a high-deductible health plan coupled with an HRA. And you know, when structuring and transitioning from a more traditional style plan to a consumer-driven plan, we generally recommend to employers, obviously it's up to their unique situation, but we generally recommend to employers that they use some of the savings, because you're going to an overall lower cost plan by going to a high deductible or a higher deductible. You take some of those savings and reallocate those savings into an account-based plan. So whether it be an FSA, an HRA, or an HSA, just depends on what you think is best for your employees. But take some, you don't have to take all, but take some of those savings and shift it into the account-based plan, and you really get employees that are much more satisfied and happy with the structures of their plan design, and hopefully you can get them to start changing some of their spending behaviors as a result. Now, last thing I wanted to touch on is, and we didn't talk about it all that much, I mentioned it maybe once or twice, but when you have a high deductible health plan, and when you couple that with an account-based plan, FSA, HRA, or HSA, and you add a wellness plan to that, you're generally going to see your greatest results. You know, wellness plans are going to reward employees for participation. And it could be reward them for meeting certain results. You know, you could have you got to go to the gym 10 times per month, and if you do that, then we're going to put some extra money into your account-based plan. It could be a tobacco cessation program. It could be a weight loss program. It could be a program that encourages you know, healthier eating habits. But you generally, obviously, a healthier person is probably going to consume you know, less medical care than somebody that's not quite as healthy. So really, you're encouraging healthy habits. You're rewarding those financially. Potentially, you are rewarding them financially. But because of those healthier habits that are created, the cost of the wellness program generally will far exceed any of the cost to implement it. So, a lot of things to consider. With that being said, that wraps up my comments for today. If you do have questions, please go ahead and type those into the chat function. If you do want to get a hold of us at any of our offices, please just reach out to our toll-free number or numbers that are on the screen. Our Benefits Administration Department that offers the account-based plans is our Flex Plans Department. Our General Agency Division that supports insurance plans is numbers listed there, and our Private Exchange number is listed on the screen as well. So please go ahead and type in any questions that you have. Just reading through some questions. There's a question, when will the HRCI recertification credit go out? 2 to 3 business days we should be sending that out. There is a question about health savings accounts. Can an HSA apply to employees over 65? In order to make or receive contributions, you have to only be covered by insurance plans that are considered qualified high deductible health plans. If somebody's enrolled in Medicare, that's not going to allow them to make or receive contributions into that HSA. However, any contributions that they made prior to age 65 and prior to being enrolled on Medicare can be used at age 65 and beyond tax-free for qualified medical expenses. So if you are enrolled in Medicare, then that's going to unfortunately disqualify you to make or receive contributions. There is a question, what happens to employees that might have a chronic illness that cannot participate in the wellness program? Generally, you'd want to find some other form of wellness program that they could participate in and allow them to be rewarded the same as if they would have been participating in the other program that most other employees would be participating in. So there are some different programs that you might have to come up with. Okay, I think that looks like it's most of the questions. I will try to read through the questions again, and if I missed any, I'll try to reach out to you directly. It looks like one more, I'm sorry, did come in. What happens if an employee has a CAT scan at an outpatient facility and has an allergic reaction to the dye? They have to be rushed to the employer. They have to be rushed to the emergency room. That's, if that happens, then that's, emergency rooms, visits, can never be completely eliminated. And when there is an emergency, an accident, in this case, a reaction to the dye, then that's gonna, then they'll have to be rushed to the emergency room. There's unfortunately no way around that. But for most emergencies, you're in a car accident, you're not generally going to be taken to an outpatient facility. You're going to be taken to the emergency room. So you can never completely eliminate those emergency room visits, but you can encourage employees to seek care for non-emergencies at outpatient or otherwise lower cost facilities. All right, well, with that being said, I want to thank everybody for their time today. I hope you at least picked up 1 or 2 new pieces of information. I know all of you are probably rather well versed on health insurance and benefits, being most of you HR experts. So do appreciate you taking some time to listen to our presentation. If you have any questions, by all means, please reach out to us. But thanks very much. For those of you that have remained on the call, we will get you out a recertification certificate here shortly. Take care and have a great rest of the week.